Hey, Miss Janine, how are you?
I'm good.
I know you were snoozing, and I'm sorry to wake you up. I've got Megan with me, just one of my friends on the floor. You haven't gotten to meet her yet. I know I've been taking care of you today, but I just got some orders from the doctor. I know you're not going to be super excited about this, but he wants me to put in a Foley catheter, a urinary Foley catheter. Have you had one of those before?
Yeah, I have when I had a baby.
You did? Okay. So do you remember everything kind of about it? And it may have been a while, but okay. So I just wanted to make sure that you were comfortable with us doing that and that you understood kind of what we were going to be doing. So
Is this gonna hurt?
it's uncomfortable. I like to say that it's uncomfortable. It can be a little bit painful depending. We don't want it to be. It's just uncomfortable. And that's why I apologize that we even have to do it. But the doctor wants us to put it in so we can really be monitoring your urine and looking at all of that, okay? So I know that I've looked at your chart, but and then we've been asking you all day, but we're just gonna kind of verify everything. Can you tell me your full name?
Janine Godey,
Okay, good. And your date of birth.
1/19/58.
Okay, good. All right, and I've looked at your chart. You don't have any allergies that's listed in the chart, but I want to still make sure that you don't have any latex allergies, do you?
No.
Okay, good. All right, so we want to make sure you're super comfortable. So I'm going to go, we're going to make sure that I've got Megan in here. She's going to help me so we can actually make this a little bit more comfortable. I'm going to go gather all my supplies, and we're going to make sure that when we come in, we're going to make sure we draw this curtain and keep you very bright. Are you warm enough?
I am, thank you.
Okay, good. All right, so I've looked at my orders from the doctor again and verified all of that. I like to educate my patient before I go and gather my supplies. I let them know what I'm going to be doing rather than coming in the room with all these scary supplies. So I've already talked to her. She said she's fine. She's had one. Now, if a patient has not had a catheter put in before, this would be an opportunity for you to explain what you're doing. Okay, a simple explanation would be that we're going to be putting in a tube into their urethra. Explain that's where they pee. Sometimes you have to use very simple terms like that, but that it's going to be basically, I tell my patients it's going to be kind of peeing for them. It's going to drain their urine into a bag that was going to be at their bedside. Okay, you can elaborate with that, but definitely explain what you're going to be doing. Okay, all right. So I've gotten my supplies. Megan, we've come back in. We've washed our hands again. Okay. And to make sure, we're going to go ahead and get some gloves on because, all right, Miss Janine, the first thing that we want to do, have you gotten a bed bath today?
Early this morning,
Okay.
they helped me get in the shower, but
Okay, well, just to be sure, we're gonna just because we're gonna be putting this is what's called a sterile procedure, okay? So it's really important that you're really clean. So I'm gonna go ahead and just get some gloves on, and I'm gonna check your vagina, just make sure everything's really clean. We're gonna get some good soap and water and just kind of clean up before we do that procedure. Is that okay with you?
yeah.
Okay, so I'm gonna go ahead and get my gloves on. I'm gonna get some warm water, and we're gonna just make sure that we get that area super clean before we put this in. And I know when you had a baby before, you probably didn't have to keep it in as long as we're going to. So what we're going to do is we're going to get this in, and then we're going to just be monitoring your urine, making sure that everything looks okay. Okay, so I'm going to move this back. I've got my warm water. I filled this up with warm water and soap. Okay, doing proper perineal care before you put in a Foley is very, very important. Okay, so you always want to make sure. I did ask if she had had a bed bath. But even if she has or he has, you still want to make sure that that area has been very clean. You don't want to assume that that the person that gave them a bed bath did a thorough enough job. Okay, so I'm going to go ahead, and a lot of times it's okay to get a blanket to kind of keep up here. I like to do that so you can kind of keep keep them nice and clean. I have made sure that the curtain has been drawn. If there's anyone else in the room, I usually will ask them to leave the room so there's as much privacy as possible. That's just thinking about your patient in there and being considerate, okay? So Megan's gonna help me. Big thing is make sure you wanna assess the mobility of your patient, do they have a broken leg? Is anything going on down here? Okay, do they have SCD pumps on? We're always looking at everything, assessing everything. I see that she's very mobile, so what I'm gonna do is, ideally we're gonna move their legs and we're gonna get those knees bent, okay? And we want to really get them out as far as we can. We'll see, I know with the mannequin it's a little bit difficult, okay? But what we're going to do is we're going to clean that area very, very good. When we're performing perineal care, this is something that we're going to do before the procedure. This is also something that you're going to do every shift while you're on the unit, okay? When someone has a Foley in. We want to make sure that we're using warm soap and water, okay? And when we're cleaning, we want to make sure that we are using a different washcloth each time we stroke down, okay? This once again is gonna go to hospital policy. Some people use wipes, but if they do, we're gonna stroke down and we're gonna change the wipe. We don't want to be, and we always go with women, front to back, right? We laugh about that and say we should know that, but just absolutely make sure that that's what we're doing, okay? Now, the big thing you want to do is that when we're cleaning a patient, okay, we've got to make sure that we get in there, okay? So we want to make sure that we're doing a thorough job. So in this case, I want to make sure that I'm using a hand that I'm moving. You want to make sure that you're moving the labia backwards so that I can really get in, because what's the most important part, right? The urethra. We want to make sure that we're not getting any organisms within in that area. So we want to make sure that we're cleaning that area very good. So in order to do that, I need to make sure that I'm moving that labia back, and then I'm getting my washcloth, that I'm going down, right, front to back, and then I get a new washcloth and go down. But make sure, now I know that I would have a lot more washcloths than this, okay? So just to show you that I'm gonna go down, don't wanna just clean on the outside, right? Because right as I specified, I wanna make sure that I've got that urethra clean, that centered part. So we're gonna clean outside, all right? But the main thing is making sure that you clean down and get that, you wanna make sure that you're getting all the way down, okay? Now, you're not gonna be able to do that if you don't spread. I know it's hard to see on a mannequin, but you wanna make sure that you're doing that, okay? That's why it's so very helpful to have another nurse in the room, because they can be assisting and helping, okay? Once I've made sure that I've done all of that, and I feel pretty good about my patient being clean, okay, then we are ready to perform our sterile procedure, okay? So I'm gonna move all that. I'm gonna wash my hands after I've completed that task, okay? Still make sure that my patient's comfortable, constantly assessing your patient. Are you feeling okay? All right, we're gonna get ready to go ahead and perform our sterile procedure, okay? In this case, I would be donning on some new gloves, okay? Since I've just washed my hands, I make sure those are dry, and I'm gonna put on some new gloves, and I'm gonna go ahead and I have all my supplies in the room, okay? I perform my perineal care, so I'm gonna get my Foley kit, okay? There are different ways you can, different places you can place your kit. I personally like to place it in the bed where it's closer. I've also got another assistant in the room that can help, okay? I find it easier to not break my sterile field if it's not behind me, or you're not gonna be tempted to have it out of your sight, okay? So I'm gonna set my supplies in here, okay? In some cases, like I said, you can have a drape over them to keep them nice and comfortable. Make sure their legs are as far as possible, okay? And then I'm gonna go ahead and open my kit, okay? All these kits should look the same. There's a nice little thing. You're gonna say peel to open, okay? So we're gonna open our kit. Okay, get all of my supplies out. Ideally, I would wanna have kind of a trash can too by me. So we're gonna open our kit, okay?